Hello and welcome to Dateline Abuja. I'm Kayla Megwa. The good news is there's a vaccine for COVID-19. The better news is we could have it in Nigeria by the end of January 2021. So before then, can we please try to stay alive and COVID-free on a personal level? Please. At least that's what the FCT administration is trying to ensure. And we will get to that in our feature story. But first, let's do a roundup of this week in Nigeria's seat of power. The government science secondary school Kankara, Katsina State was attacked by bandits on Friday, the 11th of December 2020. The Nigerian Army confirmed that 333 students were still missing after the attack, out of the 839 students in the boarding house. The boys were released on Thursday, the 17th of December, after 6 days in captivity. The governor of Katsina State, Mr. Aminu Masari, received the boys and promised to take care of them before returning them to their parents. All of this happened while President Muhammadu Buhari was in Katsina for a private visit. President Muhammadu Buhari also joined virtually the 28th Federal Executive Council meeting at the Council Chambers of State House in Abuja, presided over by Vice President Yemi Osinbajo. President Muhammadu Buhari has directed that 4 land borders be opened immediately, while other land borders are to be opened by the 31st of December 2020. The Minister of Finance was speaking after the 28th Virtual Federal Executive Council meeting, which held at State House in Abuja, chaired by the Vice President, Professor Yemi Osinbajo, and attended virtually by President Muhammadu Buhari from his home in Daura, Katsina State. According to the minister, the reopening of the border is because cases of smuggling of weapons and other illegal items into the country have reduced drastically.
Mr. President has approved the reopening of the 4 land borders, namely southwest part of the country, Ilela in the northwest part of the country, Maitagari in the northwest and north central part of the country, and Mfu in the south part of the country. So these 4 land borders will be opened immediately, while the remaining borders are directed to be opened on or before 31st of December 2020.
Vice President Yemi Osinbajo is calling on all business regulators to be SME facilitators, not SME stumbling blocks. He was speaking at the commissioning of the Abuja Chamber of Commerce and Industry Convention Center. The Trade and Convention Center, according to the Vice President, underscores the size of the nation's private sector, which he says will determine the country's economic trajectory. He's asking the Abuja Chamber of Commerce and Industry to become more active in its engagement with SMEs and create a model other states across the country can emulate.
I think that the time has come for us to have, the Chamber of Commerce paying very, very active attention to all that is going on in the MSME space, especially with respect to regulation. We must call out government officials who are making it difficult for people to do business. We simply must call them out. And this is important. If you recall, the president himself said that there is no way the private sector can thrive, no way business can thrive if government officials see themselves as roadblocks, see themselves as hindrances as opposed to facilitators. Every government regulator must be a facilitator of business.
The COVID-19 vaccine should be available in Nigeria by January of 2021, and talks are underway to ensure Nigeria gets the vaccine that fits our peculiar situation. This announcement was made by the Minister of Health, Osagie Ehanire, while fielding questions from State House correspondents after the Federal Executive Council meeting. The minister called on all Nigerians to go back to observing personal responsibility guidelines to prevent the spread of COVID-19, which has seen a drastic spike in recent times across the country.
We are working on the costing that it might be. Which one shall we get first? Obviously, the one that we can cover. And we have to remember again that we have 200 million citizens, and to find ways of being able to get enough to take care of our citizens. So that means if we're able to get the vaccine that works well and does not cost us too much on cost of delivery, cost of storage and cost of delivery, that's the one we would like. And be able to apply it in as soon as they are available. We're also having bilateral discussions, talking with manufacturers. Some of them have written to us, want to have talks with us, and I think one of them was, as I speak to you, is already having a discussion in the Ministry of Health.
On to judicial matters, the Court of Appeal sitting in Abuja has nullified the conviction and 7-year jail term imposed on a former spokesperson of the People's Democratic Party, Mr. Ulisa Ametu. The Court of Appeal sitting in Abuja has nullified the conviction and 7-year jail term imposed on the former spokesperson of the People's Democratic Party, Mr. Olisa Metu, by Justice Okonabang of the Federal High Court in Abuja. The three-man panel of the court, led by Justice Stephen Ada, in a unanimous judgment, held that the proceedings of the Federal High Court leading to the conviction of Metu and his company, Destra Investment Limited, were tainted with bias and therefore must not be allowed to stand. The House of Representatives has asked the National Communication Commission to extend the 31st December deadline issued to SIM card owners to submit their national identification numbers to their network providers to prevent blocking. The motion was moved on Wednesday during plenary by the House Minority Leader, Ndudi Elumelu. According to the lawmaker, 2 weeks is too short for 200 million Nigerians to conclude the process. The House lost the intention of the NCC for security reasons, but wants the process to be extended to 10 weeks, considering the difficulty experienced by Nigerians in attaining the national identification number. The FCT has seen a massive decline in compliance to personal responsibility guidelines for COVID-19, as have many states across the country. The problem with this is that the FCT is also recording spikes in infections. 8,900 so far, and 88 people have died. Now, while there is no talk of another lockdown in the FCT administration is calling for caution. We talked with residents on how they feel about the spike in infections, their thoughts on another lockdown, and if they will be taking the vaccine. The COVID-19 pandemic in Nigeria has been a roller coaster of fear, doubt, and non-compliance to health guidelines for over 10 months, especially in the nation's capital. From markets to places of worship, from the city center to the suburbs, non-compliance has been on the rise as the numbers of infections and deaths were on the decline. We were warned by health practitioners at the time that ignoring these guidelines would lead to a second wave of the pandemic. And now that second wave is here.
In Nigeria, the indication is that we have entered a second wave of infections, and we stand the risk of not just losing the gains from the hard work of the last 9 months, but also not losing the precious lives of our dear citizens.
The National Economic Council also expressed worry over the rise in infections, explaining that if the trend continues, another lockdown might be imminent. The explanation was made by Governor Simon Lalong of Plateau State, who himself has tested positive for COVID-19.
We are advised to go back and emphasize the implementation or the enforcement of some of the protocols that we earlier started at the first phase. For instance, sanitation, closing, and then restrictions on the numbers of people, and then gatherings and so on.
Nigerians were also informed that a vaccine for COVID-19 could be available in the country as early as January of 2021. So how do Nigerians feel about the second wave, the threat of another lockdown, and are they excited about a vaccine?
I will take. Nigerians will lovely take it. If that will help the case, I think they should go toward that vaccine and make it possible that all local governments should have it within the shortest time. And not only in the FCC, all local government, all 744 local governments should have it. Before they think of any locking down or anything, I think they should plan off from the first experience what happened. Few people who are positioned were able to be taken care of, while the masses were not taken care of. So locking down will not only they should restrict the COVID-19 social distancing. There should be a little restriction, there's a little enforcement in educating the people on how to carry on.
So we hear, so we watch on news that there's an increase, but we don't really know because it seems Nigerians are really not affected the way it is, because we're not really seeing the people that they claim to be infected with the COVID-19.
It's a common narrative here in the FCT. I don't know anyone who has the coronavirus. Well, it so happens we bumped into Mr. Abdurrahman Balogun, who works for the Nigerians in Diaspora Commission. He himself is a survivor of COVID-19.
Even we know our status. You don't know your status. You should go for tests. People are not even conducting tests anymore. So I think enforcing it is in order.
This area is the federal secretariat in the nation's capital, and we can see people coming in and out of the building without face masks.
It's sufficiently embarrassing. I think there is need for sensitization for people to know that this thing is real, and the second coming is also real. So all those things that we are asked to observe, I think the FCT should be able to make sure that people follow.
Earlier in the week, the FCT minister had a meeting with stakeholders from all walks of life, including religious leaders and health officials, on the way forward with the second wave of the pandemic.
What treatment centers are open? Are we sure that doctors, can I confidently send someone to the dome without calling somebody to be sure that somebody is there to receive the patient? Because the Honorable Minister doesn't want to be calling people to see whether there's a doctor there. So how can we ensure that the operational delivery of clinical services is happening? The same thing with public health. How do we ensure every positive gets a call, the contacts are followed up, samples are collected, and we keep at these things? It's hard. This is 10 months into the response. So I understand that it's very hard for all of us to keep at these things. But that is the situation we're in. So today's meeting really is to reinvigorate ourselves, to find the energy, to do the things we know. There's nothing any of us will say here today that will be new. It's how can we push ourselves to do this thing. Honorable Minister, my last point is on recovery. We can't wait till the end of the outbreak to start planning for recovery and resilience. So I want all of us, as we think about the measures we will propose to each other today, to really think about how to build a health security architecture for the FCT into the future.
The minister charged all residents in the FCT to go back to observing the COVID-19 protocols. He outlined basic actions that must be activated immediately, especially at the grassroots level.
We have reviewed the entire issue, and we have realized that for us to be able to save lives and livelihoods in the FCT, we have to do 3 or 4 things. First of all, we all have to appreciate that COVID-19 is here. It has come back with a vengeance. It is killing people. And that reality is something that we all, as leaders, among the entire strata of those I mentioned to you, have to go back to our various communities and send this message. Number 2, we have realized also that all the protocols established that made us successfully manage this pandemic in the FCT have all been let down. So we all have to go back to these protocols and ensure that we have massive enforcement, because that is the only way we can ensure that lives are protected. Thirdly, we have also realized that all the good work done in terms of improving the capacity and facilities in the isolation and treatment centers have to be re-emphasized and improved upon. Finally, we know that it's fatigue. Everybody is tired of COVID-19, but the reality is that it is here. So we all have to have our internal motivation and strength to be able to really take a very big leap to make sure that we jointly fight this COVID-19 second wave.
Will this second wave necessitate another lockdown? And can the nation's capital afford one? Will everyone in the FCT be mandated to take the vaccine if it does get here in January of 2021? What sort of enforcement should the FCT residents expect from the task force? Should schools in the FCT be shut down due to this second wave, as we've seen in other states across the country? What of places of leisure, restaurants, and so on? What can they do differently to keep their patrons safe? These are questions that will demand answers in the weeks to come. There are some unpopular opinions about COVID-19 that's slowly gaining traction. One is, why so much invested in a disease that has killed 1,200 people in a year, as opposed to other diseases like malaria that kills 81,640 people yearly? Another unpopular opinion has to do with the vaccine for COVID-19. There are people actively against the administration of a vaccine nationwide. Will everyone be required to take the vaccine? During the lockdown, we established that educating people on COVID-19 was more effective than arresting them. So what kind of enforcement measures are we about to see in the FCT? This week, we sit down with Dr. Mohammed Kawu, the Acting Secretary, Health and Human Services Secretariat of the FCTA, and Mr. Atta Ikaro, the Chairman of the FCT Task Force on COVID-19. Dr. Kawu, Mr. Atta, welcome to Dateline.
Thank you very much.
Thank you very
I'm
much.
going to start off with Dr. Kawu. Let's just be clear. There is a second wave.
Sadly, the kind of infection that is coming up now, a lot of them have severe symptoms. I can tell you presently there are over 30-something patients in Gwagwalada under oxygen, under very critical condition. This morning we lost one of our colleagues, Dr. Ajakpo, in Gwagwalada. For the past 3 days, we've been having an average of 200 to 300 infections in FCT per day. Nationally, it's over 1,000 now per day. So certainly the figures are rising. Whether you call it second wave or not, that is not too important as far as I'm concerned. What is important is that the cases are rising. There's an upside and something needs to be done about it.
Speaking of what needs to be done, Mr. Atta, what needs to be done?
What we need to do is to obey the health sector practitioners who are guiding us in this process. It's a health sector related problem here. And once we obey them, we won't have a problem. When you go out on the street, you get so worried, Keller. People are not putting on their face masks. Many persons are still living in the false delusion that COVID-19 is not real. Many persons don't even wash their hands regularly. Physical distancing don't even exist in most areas. I think we need to go back to those culture. What we had early in the year was a process of national consciousness, which actually disappeared midway and until we got to this second wave now. So what we need to do as a people is to own the process and go back to that place, that era when we can listen to doctors like Dr. Kawu and others, tell us what to do, and we obey them to do. And in so doing, we'll actually reduce the spread of COVID-19.
We've talked about this before, Mr. Atta. We've talked about this enforcement business. And remember when we had that conversation, I said, how many people are you going to arrest? When you say enforcement this time, how is it going to be done? Are we going to put the whole of Abuja in prison? In fact, we turned the Eagle Square into a court, you know, and people were being tried and being locked up, but that wasn't the solution.
But we still need to go back, because in the phase where you have law, there must be enforcement of law. You must enforce compliance. We can't give up. It's already a complex puzzle here. Many persons are disobeying, but we can't fold our hands and say, look, go and die. The purpose of government is the welfare and security of the citizens. Citizens must be secured. Some persons want to kill themselves. And as I told someone yesterday, we must save you from yourself and save you from killing others here. We will go out to enforce compliance. We can't fold our hands. Now you go out, you see people load buses, even 4 in the front, 2 on the passenger side, one with the driver on the same seat here. You find people standing over crowded buses. You go to some offices, non-compliance at all. We are reviving those ones back. It will lead to outcry, but as many as we can get under the circumstance to tell a story and send the signal that the COVID-19 second wave is back. Death toll is increasing proportionately across the country. You just go around, there are many unaccounted deaths, particularly with the downtrodden. Persons just die, they hardly go to hospital, and nobody is taking record, nobody is keeping record. We cannot fold our hands now.
I want to go back to Dr. Kawu. Talk to us a bit about, you know, because you had COVID-19 and you survived, you know, COVID-19. That must have done something to you as an individual, first of all. How has that, you know, changed the way you look at this disease?
Yeah, I had it. Presently, my Director of Public Health has it. She is in isolation, Dr. Josephine Okechukwu.
Dr. Josephine has
Sure,
COVID?
she is on admission presently. She is
COVID.
much better. She is due for discharge any moment from now.
No, Dr. Josephine was she was very helpful to us in the beginning. She was actually doing she headed that community advocacy thing. Yes.
She is the Director of Public Health. They are the department that is concerned with public health issues.
That brings me to my next question, which has to do with community testing. That really helped at the beginning of this pandemic, you know, and that's why I remember Dr. Josephine very fondly, because she took us for the community testing outreach in Mabushi at the time, you know, and she was doing, she had figures from everywhere. She was very helpful at the time. I wish her speedy recovery. But let's talk about that. Is community testing going to resume? Because I haven't been seeing a lot of testing going on.
Testing has increased tenfold for the last few days. We have not closed any treatment center. The treatment centers were down because the numbers were few. We had only this day dome for FCT that is functional. Functional in the sense that we had patients in. Sometimes we have 7, 8, 9 patients. But with this number now, we have over 60 in this dome.
Over 60?
Over 60, some are in oxygen in this dome. And Idu, we are going to start admitting Idu. We are not close Idu, but because there are no patients, so we couldn't take people. We are clean it and decontaminated it. We are going to start admitting by Monday.
I want to talk, before I move to Mr. Atta, I want to talk about community testing, really. Especially in places like Pape, Kubwa, Karimu, Karu.
In the next 1 week, you will be amazed at the number of teams that will enter all these communities. We must test everybody.
Are we going to reduce the number of people who gather at, places of worship again? Are you going to go back to how you did it that last time?
Now that they are open and they've all agreed and they've all signed to conform with health protocols, this time around we are going with intense advocacy.
That stakeholders meeting that I held with the FCT minister, the clerics, are they going to take the message to the pulpit?
They have taken it to the pulpit. I know the minister, we had a long meeting last night.
If there's a way to get people
the CAN leadership had talked to the pastors to take it to the pulpit, as well as the League of Imam and Ulamas have also talked to their own person. This time around it will be very beautiful.
Why are we so worried? The vaccine is coming. Why not speed up the process of getting a vaccine instead?
Do we wait and start getting killed until we get the vaccine by January? When? January. If it comes, how many people will get it? We are 200 million people. To vaccinate children under 5, some states are having coverage of as less as 10%. This vaccine is for everybody. I agree, we'll prioritize those that are more in need, but eventually everybody is supposed to get the vaccine because anybody can catch COVID-19. Are you getting me? Now, as we had, these vaccines are stored under 70, 75 degrees centigrade, minus 75 degrees centigrade. So the logistics of even getting people vaccinated is going to be enormous. So while we wait for the almighty vaccine, I will advise we don't wait and allow people to be dying while we wait for the vaccine. We should do our most potent vaccine, and that is the non-pharmaceutical means of preventive measures.
What should the residents of the FCT be doing right now? What should they expect from you?
It's very easy for us. Anybody going out should have a face mask. Those who operate businesses and office premises, government buildings will not be spared. Let's put it very clearly here. Government buildings will not be spared. We just follow the health protocols. Like what he raised, you don't say because you have met the most potent medicine man, you go and challenge spirits in the evil forest. You don't do that. That's the truth.
What kind of penalties are we talking about here?
It's left for the judge, because what we do as no, we're taking the mobile court, because once we arrest you, we cannot be the prosecutor and be the judge at the same time. Once we get you, we leave you before the judge and let the judge decide.
Mr. Atta, Dr. Kawu, thank you so much for being on Dateline today.
Thank you so much.
Thank you very much, Kayla.
It is quite shameful that we must wait to be given a vaccine. We as a country are again going cap in hand to the West, waiting for our turn to be given a vaccine. With all the research institutes we have, all the pharmacologists, wouldn't it have been great to create one ourselves? Until then, empathy is a key word here. Protecting yourself against COVID-19 also helps protect others, especially those most prone to the disease. So, mask up, social distance, wash and sanitize constantly. Let us know the happenings in your neighborhood using the social media handles on your screen. Thank you so much for watching. I'm Kayla Megwa. See you next time.